We divide trauma into two areas roughly. One trauma is that which occurs in childhood, and another one is as an adult. So an example as an adult is if you were a bank teller and you got held up, or you were in a car accident and it was very scary. Whereas a childhood trauma might be being exposed to violence within the family home over a period of years, or sexual trauma as a child. The childhood trauma can be more damaging, more difficult to treat, and less obvious because it affects the development of the person, their personality, how they view themselves and how they interact with the world. But trauma, which is unfortunately quite common, both childhood and adult trauma, is a difficult area to treat that requires specialist treatment for the trauma, but there's also frequently an accompanying depression, accompanying anxiety, and not infrequently an accompanying alcohol or substance abuse problem as people try to self-medicate away the trauma. So if someone has a depression and they have a history of childhood trauma, just to give an antidepressant for the depression, just to focus on the psychology of their current life without going back in time to the trauma is probably not going to succeed, or at best only going to be partially successful. So one needs to look at the deep roots of the current presentation.